Welcome to Conversations with the Winners. I'm Jacinta Goda, here on behalf of the Robert Wood Johnson Foundation. Today, our conversation is with Dr. Joyce Javier. Dr. Javier is an attending physician at Children's Hospital Los Angeles. She is Associate Professor of Clinical Pediatrics at Keck School of Medicine at the University of Southern California. She's a winner of the 2021 Robert Wood Johnson Foundation Award for Health Equity. Welcome, Dr. Javier.
Thank you, Jacinta. It's such a pleasure to be here.
Let's jump right in. Tell us about the Filipino Family Health Initiative.
Well, the Filipino Family Health Initiative is a nationally recognized program in community-based participatory research that is based at Children's Hospital Los Angeles and the Keck School of Medicine at USC. Together, our mission is to create a culture of healthy parenting and mental health among Filipino families.
Thank you, Dr. Javier. Talk to us a little bit about how this work relates to health equity.
Yes, so the Filipino Family Health Initiative delivers the Incredible Years, which is an evidence-based parent training program for Filipino families as a prevention tool to prevent mental health disparities in the Filipino community. Together, we conduct research focused on this prevention, and we promote equity in child health, specifically by preventing depression and suicidal behavior. Filipinos are the third largest Asian subgroup in the United States and the largest Asian subgroup in California. But despite their size, the number of research studies and programs for this group are woefully low.
Dr. Javier, you saw that mental, emotional, and behavioral health issues among young people in your community were all too common. Can you tell us a little bit more about that?
Yes, so mental health has a lot of stigma attached to it. And so it's difficult for youth to talk about their feelings with family members. And one of the studies that I found was that 45.6% of Filipina teenagers had seriously thought about committing suicide in the past year. And then half of those teens actually attempted. So that's why we asked the community, how can we address such a highly stigmatized topic? And so their answer was to focus on prevention.
You know, Dr. Javier, earlier we spoke about how COVID-19 actually did impact the community. Can you tell us a little bit more about how it was particularly devastating to the community?
Yes, so for Filipinos, 1 out of 4 Filipinos is a frontline healthcare worker. And although they make up 6% of the entire US population, Filipino nurses were especially hit hard in terms of mortality from COVID-19 pandemic. And then on top of that, because of our families members passing away, the mental health impact of that has also affected our community, including all youth. It's a mental health crisis, unfortunately, right now that we're dealing with in terms of the aftermath of COVID.
You know, Dr. Javier, the award focuses on systems change. Talk to us a little bit about how you apply the principles or innovative practices of systems change to the work that you're doing.
What we first did was try to make mental health a shared value in the community by conducting focus groups so that we could create this shared definition of adolescent mental health and well-being. And then our efforts culminated in a community-wide conference that combined the best science, faith leaders, educators, and the arts, all coming together to decrease mental health stigma. The third area of action is called transforming healthcare systems. So what we did with our project is that we worked with the LA County Department of Mental Health and used our research findings to advocate for the Incredible Years to be added as a billable preventive intervention. And then the fourth action area is strengthening integration of health services and systems. So we did this by connecting primary care and schools and churches and community organizations to behavioral evidence-based practices.
How important do you think that cultural connection is, Dr. Javier?
That is an excellent question. It's so integral. Research shows that the more we're proud of our ethnic identity and our cultural background, the higher self-esteem we'll have, the more positive mental health and outcomes that you'll have.
Take us through a few lessons learned, how we can benefit from the lessons that you have learned over the years.
Yes. So the first lesson, I think, is really the power of community-based participatory research. And so we ask teens, we ask parents, we ask church leaders, educators, mental health providers, government leaders, and their collective answer was to not wait until their teen years to really focus on building strong parent-child relationships during the school age years by offering these workshops. The second lesson learned is the importance of kapwa, which means shared identity in this work. FFHI is a great example of the proverb, if you want to go fast, go alone, but if you want to go far, go together. So in a sense, it's because of our shared identity that we were able to work together and help other communities.
Dr. Javier, what does receiving the award for the work that you do mean to you?
Well, this award is deeply meaningful. It's really enabled us to be acknowledged for sharing the gifts and strengths of the Filipino culture with others. So my hope really is to spread the power of positive parenting to as many families as possible.
Dr. Javier, on behalf of the Robert Wood Johnson Foundation and the Asian Pacific Islander Caucus for Public Health, thank you for all the work you do, and congratulations again on your award.
Thank you very much, Jacinta, and thank you to the Robert Wood Johnson Foundation and the API Caucus for Public Health. It is truly an honor, and I look forward to continuing this work.
Thank you for joining us for this conversation, and you are invited to more conversations with the 2021 winners of the RWJF Award for Health Equity. And you can learn more about all of the winners at rwjf.org. I'm Jacinta Goda, and thank you for watching.